Hey guys, how's everyone doing? So I'm Jacqueline, one of the co-founders of Candour Beauty. So I don't know if you saw our video yesterday where we announced what we'll be doing a couple of lives for a few weeks. We will be having different experts and guests. And for this one today is really, really exciting. We have Dr. Ifeoma Ejikeme, who's just joined right now. Let me just let her in. 2 seconds. So today's live is really going to be about Skincare 101. We're going to talk about a couple of things around the skin.
Hi.
Hello.
How are you doing?
I'm well, thank you. Thank you. How are you?
I'm good. It's so good to be here. Thank you for inviting me.
Thank you. Thank you for being here. This is really exciting. Thank you. Cool. I can see a few people joining. Hello.
Hi, everybody.
Hello. How are you doing? How's your day been?
It's been good, actually. It's been good. Today, I don't know, it's something about lockdown at the moment. It's just kind of dragging now. I'm like ready for December 2nd to get here.
I know. There's an eagerness to get to the get to the
Yes.
end, right? I know. Same here. I feel that as well. There's just all excitement with everything going on, and Christmas. We want to get out, do our Christmas shopping.
Yes.
Yeah.
I've
But yeah.
started with Christmas. I've just decided just to get going with Christmas.
Yes.
I've started doing my Christmas decorations. My Christmas music is certainly on, so I'm ready.
Yes, I've seen loads of people have started doing their Christmas decorations early. I haven't started as yet, but possibly this weekend I might pull out the tree and start decorating. Definitely get there early. Cool. Well, this is nice. So I don't know if we should get into it, or I could do a quick, perhaps maybe introduce yourself to those who are currently here.
Sure.
So tell us about yourself.
Sure. My name is Dr. Ifeoma Ejikeme. I'm the founder and medical director of Adonia Medical Clinic, a skin hair clinic based in West London. And my background is in general medicine. I'm a general medicine consultant, and I have specialist training in head and neck surgery as well as training in aesthetics. So I do skin, all things skin, also body treatments, hair loss treatments as well. And it's lovely to be here.
Thank you. Great. So for those of you here, thank you. So this is going to be our first in a number of series that we'll be having a number of experts and some of our brand founders join us. What we want to do here is not only just obviously tell you about the wonderful products we have, we also want to use this as a perfect opportunity to inform you with different information of how to take care of your skin, your hair, just how to live your best life and just be the most beautiful you can be. So without further ado, I think we get into it.
Yes.
Cool. So the first question is, what is it that we need to know about people like ourselves with darker skin tones? What makes our skin different?
So our skin is different because of melanin. Everybody actually has melanin, but there are different types of melanin. There's fair melanin, which gives you kind of a red pigmentation, more like freckling. And then there's eumelanin, which makes our skin darker, which makes black skin black. Now, there are some differences in skin between Caucasian skin, Asian skin, and black skin. But these are really scientific. We say that there's different amounts of ceramides in black skin, which means that you can be drier. But I think this is academic. For practical purposes, it's more about the conditions that's going on in our skin, which actually transcends all skin types. Things like, do you have oily skin? Do you have dry skin? And addressing that. So it's less about your skin tone. It's more about your skin condition. So listening to your skin, and everybody's skin is different. There's nothing that you can say that's universal to black skin or universal to Caucasian skin. It's every individual skin is different. So I really like to treat each person differently and figure out what's going on with their skin and address that.
Okay, so what is it that we need to be made aware of? Let's say when we're taking care of our skin more at home, because I've read a couple of articles. Even my experience with my own skin is that we're very hypersensitive, right, to pigmentation. So we might get one pimple, and we're definitely leave a mark. So for me, I find that that's specifically for us with darker skin tone.
So that is the one thing, pigmentation. And that's probably the number one thing that my patients, my skin of color patients, my black patients discuss with me and have an issue with is pigmentation or hyperpigmentation. And you've hit the nail on the head then. If you have one spot, it's not just about the spot, it's about the pigmentation that's left behind. And that can last anything from 4 days to 6 months.
Yes, because even you don't even have to pop them, right?
Yeah.
Sometimes just the fact that the skin is raised leaves a mark.
Exactly. It's inflammation, and it's the result of inflammation. So the response that black skin has to inflammation is to produce pigment. Now, inflammation and trauma can be anything. It can be pressure, it can be the sun, or it can be even stress, melasma, all of these different things that cause an increase in inflammation. The skin will respond with pigment. So it's about having something in your routine that can overcome that. So the key aspect in your skincare routine, and my skincare routine, and all my patients, is a tyrosinase inhibitor. And these are a group of products that help to balance the pigment in the skin, not change the underlying skin tone, but reduce how long that dark mark stays there, because we know it's coming. No matter what, you're going to get a dark mark in the skin. It's just how long it's going to stay for. So that's the key aspect in terms of a skincare routine that you should add into your skincare.
Yeah, definitely. I think that's why one of our products is our bestseller, which is the Nuhanciam Factor 4 Anti-Dark Spot Serum. I think it's perfect for anybody to have within their routine, because I don't use it throughout every day of the month, but I do use it especially when I'm about to break out or when something has come up. I definitely use it more to make sure I, you know, put those dark spots at bay. But definitely, thanks for that. Okay, so thinking about time, because I don't want us to have too long of a time, I wanted us to just talk about skincare within the different ages, right? Because I think from a 20-year-old, 30-year-old up to 50-year-old, I think our skin is very different, and even our approach to skincare is very different as well. Because I think in my 20s, I was not the best. I slept in makeup. I used St. Ives. I was the worst. You know, it was just not the one. Not every day. I didn't see makeup every day, but I just had very bad habits, you know. So what is it that we need to be made aware of, let's say in our 20s? What is it that you should be mindful of?
Yeah, because in your 20s you think you can do anything. You know, you're indestructible. You think your skin is indestructible, and your skin behaves like it's indestructible in your 20s. You know, you can pretty much do anything to it, and it seems to bounce back. But the problem is, it bounces back in your 20s, but the damage that you do in your 20s show up in your 30s. So in 20s, it's all about having a good skincare routine. A very basic cleanser, moisturize, sunscreen. So it's all about protecting the skin. In your 20s, unless you have a specific skin condition like acne, most people's skin is relatively balanced, a little bit oily, a little bit dry, but tends to be quite balanced. So it's about having a good skincare routine and protecting. So 20s is all about protection. Wear sunscreen. You won't really see the results in your 20s, but in your 30s, 40s, and definitely 50s, that protection is really going to show up.
Exactly. Cool. Great. Thanks for that. So definitely be mindful of that. So in the 30s, what do we need to be made aware of?
So I would say the 30s is all about control. So as in your 30s, you're starting to control different aspects of your life. In the skin, it's the same. You know, sometimes things like acne will start for the first time in the 30s, and this is really common. So it's about having now intelligent ingredients in your 30s. And in the clinic, at Adonia Medical Clinic, we talk about this all the time, about having intelligent ingredients. So if you're having things like acne, having a consultation in your 30s to try and get to the bottom of it to prevent scarring. So adding ingredients like salicylic acid for acne, adding in glycolic for pigmentation, adding in retinols to start thinking about age management. This is your 30s. And one thing that's quite contentious, but I think is a good addition to your routine, is an eye cream. So eye cream
at 30, but sometimes I think there's not an understanding of exactly what eye creams do, especially if it's not specific to dark underlying circles, or you don't really have fine lines at 30. Not everybody, right? So so eye creams tend to be associated with people older, like in the older age groups. So you're saying 30s.
Yes, and that's the error. So in your 40s, 50s, and 60s, an eye cream is not going to reverse those lines, that pigmentation, that thin skin. It's not going to reverse it. You're going to need something much more. So eye creams for me are all about prevention. So you use your eye cream to improve the moisture, to prevent free radical damage, so that you don't go on to get the signs that you see in your late 30s, in your early 40s, and in your 50s. So an eye cream is really comes into its own before you see those issues.
So it's prevention better than cure, for sure. I
Absolutely.
see, I see. Okay, so
Now,
that's definitely an error I can attest to that I need to do then, definitely. Thank
yeah, so
you.
bring in the eye cream. Now, in your 30s, it's also the time to check in with your skin and to think
Mm,
about what treatments can you start doing to actually rejuvenate the skin.
mhm,
Now, after the age of about 25 and certainly by 30, you make about 1% less collagen every year. So in your 30s, it's again the time to start doing things that retain your collagen and boost your collagen. So treatments like microneedling can be great. So again, we're not going to wait until we see that drop in the skin, until we see that lax skin. We're going to start doing gentle things in your 30s. Now, in black skin, you can have microneedling, but we prepare the skin. Again,
mhm.
with that tyrosinase inhibitor we talked about, things like kojic acid, licorice extract, vitamin
Yes.
C, arbutin, these
Yeah.
sorts of ingredients. And you can safely have microneedling as well.
Oh, I love you mentioned licorice extract. I think in
Yeah,
one of the Epara's cleansing oil actually has that, and a
yeah.
couple of other products that seems very, very fantastic. Okay, great. So now in your 40s, what do we need to be made aware of?
So your 40s is more about reversing. Now, some things have happened, some things are now there and they're ingrained. You might have pigmentation, you might have
Mm,
scarring from previous acne, you may start to notice fine lines and wrinkles. So now this is about reversing. So you're
mhm,
going to lean into ingredients that hydrate the skin. So
mhm,
again, in your 30s, skin can start to change. You know, whereas previously you may have noticed you were very, very oily, your skin may start to feel more dry. If you were dry before, it may start to feel more sensitive. So again, you're going to review the products that you use in your 30s and add in ingredients to pull moisture into the
mhm,
skin and then lock it in.
mhm.
Ingredients like hyaluronic acid now,
Yeah,
ceramides,
yeah.
things like this to really boost the skin and give your skin that glow that you used to have in the 30s.
Yes, yes, the useful glow.
Exactly. We're going to ramp up the retinols to really, really start to stimulate collagen at a much higher level. And we're going to be moving towards retinoic acid from the very gentle retinoids that we used before.
Fantastic.
And then in the clinic, again, I'm going to look at treatments to, again, boost that dermis. So we're
Hmm.
going to look at things like high intensity focused ultrasound, which will help boost collagen, but much
What does
more.
that mean in layman's terms? Just to, yeah.
So
What is,
high intensity focused ultrasound is HIFU.
mhm.
It's normally nicknamed HIFU. So this is a treatment that is a device you place on the skin and it applies ultrasound technology to boost collagen in the skin. So it's at a much deeper level now to really
Okay.
start springing back the skin. Now, black skin often we hear that black skin doesn't have the same sun-related changes as Caucasian skin,
Of
but
course,
we
yeah.
certainly do have sun-related changes. Now, we've got like aging that's intrinsic.
Hmm.
Everybody has that.
Yeah.
And in black skin, that shows up as open pores, as increased laxity in the skin,
Hmm.
deepening of the nose to mouth lines, the nasolabial folds,
Of
and
course.
sinking of the eye. So these are the kinds of signs you'll see on the skin in the 40s. So
Okay.
these sorts of treatments will address those sorts of
Okay,
signs.
so it's not necessarily the wrinkled skin that or crow's feet that we tend to see in
No,
magazines. Yes,
no,
definitely. I
no.
understand. Yeah.
Black skin ages differently.
Definitely.
And the predominant thing in the 40s that you may start to see is something called dyspigmentation or mottled pigmentation, where the skin, the even skin tone just changes.
Hmm.
And it doesn't look quite as even as it used to. Instead, you see
Yeah.
areas that are slightly light, areas that are slightly dark. And that's the mottled pigmentation that's a sign of aging in black skin.
So is there anything that you could do? Okay, obviously you've just discussed we need to use eye creams in our 30s. So
Yeah.
is there anything we need to do to prevent things like that happening?
Yep, sunscreen. So we've got extrinsic aging, and extrinsic aging is what's really going to cause fine lines and wrinkles. So with black skin, we have some protection. We have some sun protection, natural sun
Yes,
protection.
yes, yes.
But even the deepest, darkest brown skin, the maximum, the darkest person you've ever seen, the maximum protection that their skin gives them is about factor 13.
Yes, yes.
And so if you're wanting to protect the signs of extrinsic aging from the sun, you need factor 30.
Wow.
So yes, we get a bit of a head start, but it reaches up to everybody.
Of course,
So
it
if
catches
you,
up for sure.
yeah,
Okay, cool. So let's move on to the 50s. What do
sure.
we need to be aware of then?
So in the 50s, all the things that I've now described, the fine lines and wrinkles, deepening of those fine lines and wrinkles, uneven skin tone, and we're going to need treatments and products to really try and address those. So with this, if somebody has these sorts of things, we need skin transformation. So we need to do a system that's going to now kick in the skin's natural healing ability, which is there all the time.
Yes.
Increase the skin turnover with more prescription or medical grade ingredients now. So we need to be doing things that will really affect the skin at a cellular level and change them. And the great thing about skin is that's possible even in your 60s.
Oh, good.
Yeah, so it's possible. Better to prevent, but it still is possible. So at this stage, whilst I think about toxin, as in Botox and dermal fillers, at any age, really, any age that you've described, if you've got a lot of volume loss and we need to lift, this can be done naturally, and it is safe and effective in black skin. I think a lot of the time we don't talk about it enough.
I think picking up on that, because I know it's not a question, but fillers in black skin, what is it's not a taboo, but what is the, you know, there's some mystery around, you know, black people and Botox and fillers. What is that about? And, you know, what do we need to be aware of?
We need it too. We need it too. But it's different, you know. With Caucasian skin, with aging, the predominant factors are fine lines and wrinkles. And that can happen in the 30s and certainly by the 40s. Now, in black skin, it happens slightly later, but it still happens. Deepening of the 11s, you know, the glabellar lines, these lines here, deepening of the nasolabial folds, loss of mid-face volume is a real factor in black skin, which is why we tend to see deepening of the nose to mouth lines. Now, the way that's corrected is by a little bit of dermal filler right here. Now, if you just watch my eyes, if I place a small amount of dermal filler here, you see how it just changes the trajectory of that little area underneath my eye. Now that's what we can do with dermal fillers, and that's safe and effective in black skin. And I'm seeing much more of my black patients having Botox and fillers to address issues that bother them for decades. Because in magazines you don't really see it associated. Black skin Botox, black skin fillers. You don't see that.
And I think it is around all the language that's used, right? Because we tend to see it as an anti-aging thing, and anti-aging isn't really associated with black skin, because, you know, everyone says, oh, black doesn't crack. So it's not something, right? Even needs fillers, for heaven's sake. but yeah, so it is really interesting, and I think something we definitely should pick up. Of course, definitely visit your page for more on that, because it is something interesting. I know we've spoken about it, where I've said, oh, do you feel? You said, yeah, just touch there. And every minute now I'm just like, oh,
a little touch.
That's how I told you it's a slippery road.
It's not a slippery slope. It really isn't. Everybody thinks like Botox is some kind of gateway drug. It's not. It's not.
Honestly, there's a fear.
It doesn't mean you have to have it every single month or every 3 to 5 months. You don't. It's about, you know, and I think that's where you have a relationship with a good doctor that can actually help identify what you need now, what you need in the future, and it's about managing. It's a two-way street. You know, I have patients that have toxin or Botox, you know, once a year, or have dermal fillers once in 2 years, because we're trying to maintain, not to change in some unusual way, but just really to gently maintain, so that you keep looking young and fresh. Just fresh.
Age with grace. Exactly. Gracefully aging. Okay, cool. All right, that was exciting. Something new there. Maybe consider it. I'm not sure yet. Okay, so just looking at the next question. Fine. So you have an amazing award-winning clinic, right? So, and I'm sure you've seen millions of people. But what are the common skin mistakes that people have come into your clinic? So what can we do to prevent? Yes, we want to come into your clinic for other things, but what can we do to prevent the mistakes that you have seen?
So one of the mistakes that I often see is using too many ingredients. Now, there's so many different channels that we think, okay, try this, try glycolic, try salicylic, try nasalic, try this, try that, try this. And using too many ingredients causes issues. Now, those issues in black skin turn up as acne, pigmentation, irritation, and dryness. And actually, in all skin types, you get this irritation and dryness, but with black skin, it's the pigmentation that you can get. Now, over exfoliating your skin, it's important to know that it can trigger acne in anybody, even someone who doesn't necessarily have acne before. So it's important when you're starting treatments to start them slowly, to work in combination with someone who knows, you know, skin, someone like myself who understands skin, and start things slowly. But if you're doing it at home, start one new ingredient. Try it out for about 3 to 4 weeks. See how your skin reacts with it. If it's great, continue. If it's not great, take it out of your routine before you add something else in. So that's something really important. Now, in the clinic, I have people on 4 or 5 different actives, but we're trying to get to a specific a specific result, and it's done so I know how to manage their skin. But if you're doing it at home, take it really, really slow. I think that's probably the biggest mistake people have when starting their skin journey.
Yeah, and I think there's so much information out there now, right? You know, yes, we're a retailer, but we see so many different influencers talking about skin, what's the right skincare routine. There's too much information, but what is right? That's the danger of when crossing that line of using too many acids into your routine. But, you know, I wanted to touch on something. You mentioned over exfoliating. What is over exfoliating? Because I don't know if I'm borderline, because I think some weeks I exfoliate maybe 4 times a week, which I don't know. But is that a mix of, you know, what can I say, like a cleanser? I also use like an acid toner. Like, what is over exfoliating?
So exfoliating is just using a substance to remove the upper layers of the skin, and that can be physical exfoliation. You mentioned St. Ives, that's a physical exfoliator.
We don't use that.
No. Or any scrubs. Or you can even have a treatment like microdermabrasion. That's a physical form of exfoliation. Then you have chemical exfoliants, where you place a product on the skin and you can't really see it, but at a micro level, it's then sloughing off the top layer of the skin. And these are your acids, things like glycolic acid, or salicylic acid, xalic acid. These are all exfoliants. Now, they can be in your cleanser, they can be in your serum, they can be in your moisturizer. So over exfoliating, I would say, is using multiple different acids in multiple parts of your routine. That's unnecessary. Also, exfoliating multiple times through the week. Also unnecessary. Now, if you have a chemical exfoliant and you're using that as a cleanser, that can be fine throughout the week. If you have one exfoliator, for example, you exfoliated your cleanser and you use it Mondays, Wednesdays, and Saturdays, absolutely fine. Or even every evening. But when you have multiple steps that you exfoliate in your routine every day, that's certainly going to be too much.
So just one active in your routine, basically.
Exactly. Now, things like masks, clay masks, can be an exfoliant if they have microgranules in it. So you have to be careful and understand which step in my routine is exfoliating. And then check in with your skin. How does your skin feel? If your skin is feeling tight and parched, your eyes are feeling strained, you don't need any more exfoliating. You've gone too far. So then you're going to back off any form of exfoliation for even a week. Come off all of it. Let your barrier restore, and then think about going back to it.
Yes, definitely. I definitely agree with that. Okay, cool. So an exciting one I want to talk about is skin bleaching. Yes. I like that response.
Skin bleaching.
Yes, there's a lot of, there's a lot of conversations around skin bleaching. There's a lot of misconceptions about skin bleaching. There's a lot of misunderstanding around that, so what is skin bleaching? Let's first.
So there's 2 ways to think about skin bleaching. One is the medical terminology, and the other is the colloquial, the way we talk about it culturally. So I'm going to start with the medical terminology. So any medication that has been clinically proven to change pigment in the skin is termed a skin bleaching agent medically. Now that's really important because we use it, and it's important to have medications that are able to work on black skin to remove pigmentation. Now, imagine someone that has face covered with just a lot of acne, and they're left with dark marks everywhere. That person needs a medical treatment to remove that pigmentation that has been clinically proven to work. On that bottle, it will say skin bleaching agent.
Correct.
That person needs to have the confidence in their doctor to be able to have a treatment that will help their skin. In the same way if they have acne, in the same way if they have rosacea, in the same way they have melasma, in the same way they have diabetes, they need to have an effective treatment that works. That is medical skin bleaching. Then we have skin bleaching that we use culturally. In black and Asian skin, we understand culturally that skin bleaching is thought to mean trying to lighten your skin away from your natural ethnicity. And I think that's the thing that people have a lot of problems with, trying to change your ethnicity using products. Now, in that way, what we understand with skin bleaching is using products that aren't regulated, haven't been prescribed, usually dangerous, found on the black market to change your skin tone. And that leads to all sorts of problems that I see day in, day out in the clinic.
Yes, yeah,
Real serious problems in the skin that are challenging to treat.
Okay, that's in the black market, but you know, sometimes there's a misconception around certain words that are used on products. Let's say skin, like the toner is brightening toner, right? Or it's a brightener. So people are just like, oh, is this skin bleaching? What does this mean?
Exactly.
You know,
so I think it's so important for Black and Asian people to start controlling this conversation. Because if we have issues with our skin, if the number one issue that Black skin has is pigmentation, the number one issue, uneven skin tone, pigmentation, then we need to have effective products to be able to treat them. Now, historically, Black-owned businesses have not been controlled in that conversation.
Yeah.
Everybody has pigmentation. Black, white, and Asian, everybody has pigmentation. And so the way in which you lift freckles is to brighten the skin. If you have uneven skin tone, you brighten the skin. With Black skin, it's the same. If you're going to remove pigmentation, you are going to brighten the skin. So I think it's really important that we don't walk ourselves to a situation where we say, all brands, please don't make any products that we're able to use to fix the number one issue that Black skin has.
Yes.
So I've been watching this conversation about, you know, bleaching. These are very separate things. Skin bleaching and treating the number one issue that Black skin has. There's nothing wrong with that. You have to take ownership of your skin, take ownership with the things that concern you, and do it in a safe and responsible manner. You know, if you've got dark circles and it's pigment related and it bothers you, you should have effective products to treat it.
Yes, of course.
You know, and if that says it's a brightening ingredient, there's nothing wrong with that. Use a product that treats the issue.
Yeah, because I think I've had many conversations with people who just have the wrong understanding of what a brightener is. You know, they're like, oh, but isn't that? I'm like, no, it doesn't. No. You're not bleaching your skin. I think there's that, you know, there's also the fear of, you know, we were talking about Botox or fillers earlier about the slippery slope. They think, oh, if they start this, then you're on a slippery slope. But it's actually definitely not the case. That's very interesting. Okay.
Yes, I just think it's important that you've got Black skin, you should have, and you should be empowered to treat it. Now, very different from black market bleaching your skin, using products that are not regulated, trying to kind of change your ethnicity. These are large conversations.
But deeper issues at hand. Yeah.
Yes, but it's not about having a skin concern and finding effective products. I would welcome more brands to create effective products to treat Black skin. We should be encouraging that, you know, not shutting down the conversation and saying, oh, no, don't do that. It's up to the individual to pick an effective product, but don't use something that's going to harm yourself.
Okay, cool. Thank you so much. I don't know if you have time for one more question, because we had a couple of questions that came in. So I'm just going through them now. Sorry, I just wanted to say, so, okay, since everybody's at home using devices and phones, blue light, what is it about it that's harmful to the skin? Is it a myth? Is it true? What is that about?
So blue light or visible light is the predominant place that visible light comes from is the sun. So the sun emits many different rays, UVA, UVB. We've got UVB that burns the skin. UVA travels deep and causes DNA changes. And visible light also has changes to the skin. It can also cause damage to the skin as well, mostly leading to pigmentation. So the big link with visible light is that it causes almost tanning to the skin or changes to the skin tone. Yeah, so that's one of the big elements with visible light. Now, visible light, tiny amounts or comparatively tiny amounts are also emitted from devices, the phone, your TV, your screens as well. But it pales in comparison to the light that comes from the sun. So it's not something that people need to worry about, because of the sun is just, there's so much more coming from the sun. It's minuscule amounts comparatively coming from devices. But if you are worried about it, there are ways to protect your skin from it. Now, sunscreens, some sunscreens, if you read them, will say protection from visible light. You can use that. But also, this is one area that makeup can come in handy. A lot of makeup has iron oxide and zinc oxides, and those also protect you from visible light as well. So not something I would worry about, but if it does bother you, there's some very simple steps you can take to reduce the impact it has on the skin.
So just wear sunscreen, basically.
Sunscreen. Well, sunscreen that has protection from visible light.
Yes. Okay, awesome. Well, thank you for that. that was exciting. And I think I have learned a lot. Well, I've got quite a lot of information. I don't know if anybody who is currently on the line has any questions they want to put into the chat or anything before we round up. While we have Dr. Ejikeme here, have an expert here. We don't know, but that's fine. Okay,
Oh,
I'm
getting a lot of love. Thank you, guys. Ami, I hope to meet you too one day.
Yes,
That's
she
lovely.
is. She is. She really is. But thank you so much for your time. We really appreciate it.
You're welcome.
And it'll be exciting to have you back. I think we really want to dig into the whole skin bleaching, skin whitening. I think that's a topic we really want to get into.
I think that would be great. I think that would be really great to have, to have a proper chat about skin bleaching, skin whitening, skin brightening, different things people should not be doing.
Yes.
And understand, really going into that. But I'm glad we touched on that. It kind of gently scratch.
Yes, because it's not just the face as well, right? Because there's also the body. The body tends to change in pigmentation as well as we age as well, even as we go through different life cycles, pregnancies and everything else. So definitely something we can touch on. Okay, there's what is the best foundation for Acne Pro? Ooh, not too sure on foundation. It really all depends what you're looking for.
So with foundation, the only thing I would say with foundation is if you're oily, if you're very oily, but especially if you're acne prone, with foundation, you want to use a foundation that's oil free. Some of the mineral makeups are also good, but you want to find something that's definitely oil free that won't worsen your acne. There are lots of brands now. NARS does it, Dior does it, does some great foundation.
I think also it's about the primer, what base you use as well. I think is quite important. So sometimes it's not necessarily the foundation. It is really about what base you put on beforehand. Because yes, you put on your moisturizer if you wear SPF, but also what primer are you actually using under that foundation? I think is key for protecting your acne, because they are obviously open as well, and you don't want any bacteria in there. So having a good primer, I think, is something that you should look into. Then go into your foundation, because it's skin first always.
Absolutely.
Skin first always.
Drizzy Dave said this was so informative and easy to understand. Thank you. Oh, that's really kind. I'm glad it was digestible. We always try to be digestible, so I'm glad
yes, and I didn't make any technical errors, since it's our first one.
You are amazing. Absolutely amazing.
Thank you.
And it's so lovely to be on here.
Yes, we look forward to many more. But thank you, guys. I think we can end it here. So we had a nice 30 minutes. Thank you so much. Appreciate it. Have a good evening, everyone on the line. We'll hopefully catch you next week.
Bye, everybody.
Bye.